Hello, my name is Dr. Yoshihiro Katsuura, and I'm a board-certified orthopedic spine surgeon practicing in Northern California. Today I'd like to talk about medial branch blocks and medial branch transections, two very common spinal procedures that can be used to relieve pain, particularly in the low back, but also in the neck. So let's dive right in. Medial branch blocks, otherwise known as MBBs, are blocks that take away pain from the facet joints, which are paired joints between the two adjacent vertebrae in the spine. Similar to other joints in the body, the facet joints may become arthritic and painful, and that can be a source of low back pain. The nerve supply that conveys the sensation of pain from the arthritic joint in the back to the brain is known as the medial branch of the dorsal spinal nerve. Anesthetizing the medial branch with a local anesthetic is a reliable treatment for low back pain, and this injection is called a medial branch block. It's an injection usually done in the office or in a surgery center using X-ray or ultrasound guidance. If the medial branch block is successful, it can segue into what's called a medial branch transection procedure. This is a minimally invasive endoscopic procedure that's very similar to a radiofrequency ablation procedure, or RFA, which you might have heard of. If the medial branch block provides greater than 50% pain relief, in other words, after you get the injection you notice a substantial decrease in your pain, it can qualify you for having a medial branch transection, which is a small procedure where the nerve is actually clipped or burned permanently. And this can provide durable pain relief, usually greater than 1 year, but sometimes up to 5 years. So let's take a look at how this procedure works. Here you can see the lumbar spine is collapsed, and you can see that these facet joints have become painful and arthritic. The blue lines are the medial branches, which are the nerves that innervate the facet, and that's what conveys the sensation of pain to the brain. We can do a medial branch block by putting in a little local anesthetic and steroid, and that can temporarily block the pain transmission. But when the block wears off, the pain also returns. And so a medial branch transection can be performed in that instance where an endoscope is inserted into the spine, the nerve is visualized and transected using a small pair of scissors or a little cautery device. In conclusion, both MBBs and MBTs are safe and effective treatments for low back pain that can be even more effective than traditional ablation procedures or RFAs. All procedures carry some risks, such as sensory loss at the skin or numbness, and or failure of the procedure to completely alleviate pain. This list is not extensive, so please discuss it in detail with your surgeon and or physician, and follow me for more.